Vaginal dryness after menopause is common, but here's something many women don't realize. It doesn't always get better on its own, and for some women, it can actually get worse if left untreated. In this video, I'll explain why this happens and what can help. So after the menopause, we produce less estrogen, and estrogen is key for keeping vaginal tissue thick, elastic, and naturally lubricated. So without estrogen, vaginal tissue can get thinner, it loses elasticity, and it produces less moisture. Blood flow can also be affected, and the pH in the vagina can change, and this can make dryness a lot worse. Unfortunately, the dryness doesn't always reverse post-menopause, and some women find that symptoms can get worse or can suddenly appear as well. So the factors that can make this worse, so it can be things like reduced sexual activity, certain medications such as some antihistamines and antidepressants can do this. So always check the side effects on any prescribed medication that you're taking just to see if it's part of the problem. And it's the normal aging process as well, unfortunately. But remember, this doesn't happen to everybody. So I don't want people worrying that this is something that might happen, because it's not 100%. So the signs that this is ongoing rather than easing off can be things like tightness, it can be burning, it can be itching, it can be pain after sex, it can be bleeding after sex. It can just be a feeling of sort of heaviness and discomfort every time that you sit down. It can be urinary tract infections, and there's a really common link between both of these. It can be repeat infections, it can be urgency, it can be a little bit of discomfort when going to the toilet as well. The potential consequences of this, if left untreated, can progress to what's called vaginal atrophy. So this can lead to sort of worsening of all the symptoms that I mentioned before. It can cause more bladder issues, it can cause a lot of discomfort during sex, and also your general health quality as well. The things that can help, so there's good news, there are things that can sort this quite readily and easily. The non-hormonal side of it, you can get really good natural vaginal moisturizers. It's really important here to try and get them without all these chemicals, because that can make things worse, especially if your vaginal tissue is already burning and itching. So these lubrications, the best ones to get, if you go to your health food shop, there'll be organic ones, there'll be natural ones, and it can make a huge difference when you're having sex as well. And there'll be less sort of anxiety and hesitancy too. You can go down the hormone route, but obviously you need to speak to your doctor about this. So you can look at very low estrogen products. So it can be creams, it can be rings, it can be vaginal pessaries as well. Lifestyle too, so there's a lot of things you can do here. Don't forget that lots of things can irritate the vaginal area that we tend not to think about at all. So it can be things like bubble baths, your shower gels, your soaps. It can be things like sanitary ware. You might not even be aware that a lot of sanitary products around now, the papers and contents, they're bleached, they've got antibacterial things in them, they've got plastic in them. So really be aware of this side of things too. Toilet paper, who would think that toilet paper could be irritating, but it certainly can be. And also, if you've had lots of antibiotics because you've had urinary tract infections, that can be a big factor interfering with the vaginal pH and also the friendly bacteria in the vagina. Remember to stay hydrated. It's really important. We get so dehydrated in the perimenopause, menopause, and postmenopause, and that can be a big factor in vaginal problems as well. Look at your sea buckthorn oil. It's absolutely fabulous. You can either use that to apply as an oil make sure it's organic though, or you can get sea buckthorn oil capsules that work from the inside out. If you've had lots of antibiotics for any kind of urinary tract infections, then you can go with a vaginal probiotic. Again, you can get that from your local health food shop. When to see your doctor? If this condition gets steadily worse to the point where it's causing daily pain, if you are getting lots of bleeding after sex, if you find that you're getting an awful lot of discomfort when you're doing nothing, even sitting down, please speak to your doctor. There are other things that they can recommend. So this is one, please don't suffer with this. Hope you found it helpful. Please, if you've had any experience with this, what did you use? What did you use? What did you find really helped you? I love to hear your stories. Have a lovely week, and I'll see you soon.